Hello, everyone. Welcome. So glad you guys are here. I'm excited to talk about mental health and coaching today. Seeing all these names, new faces, old faces. Happy to see everybody. Come on in, get settled. Make sure you've got your water, got a pen and paper if you want to take notes. If you're walking and listening, that's great too. Just happy you're here. We can spend a little bit of time talking about this. It's such an important topic. I still see the numbers going up. So wait just a second. We've got so much to cover. I know I say that every time we have so much to cover, but we legit have so much to cover. It's going to take us that full hour, and we're going to be moving pretty quickly. So this may be one you want to go back and watch again too, because I have a feeling there's going to be lots of little nuggets that we're just speeding right through. All right, let's go ahead and get started. Super happy you guys are here. Like I said, this is for mental health and care, the making of happy and healthy humans. That's why we're all in the coaching business, right? My name is Ashley Honeycutt. I am the Director of Health Coaching Operations here at YourCoach Health, as well as a board certified health and wellness coach. And for those of you that we haven't met yet here at YourCoach, it is my pleasure to introduce you to YourCoach. We are an all-in-one practice management platform that is tailor-made for health and wellness coaches by a health and wellness coach. Our platform is designed to give you everything that you need to run your practice smoothly. That's from HIPAA compliant chat and video sessions, session notes, comprehensive library of resources, everything you need to manage your clients in your practice. At YourCoach, we are committed to supporting you as a practicing health and wellness coach in every way possible. That's why we offer webinars, access to legal experts, business coaches, and other valuable resources to help you grow your practice, all at no cost to our community members. And yes, that even includes these continuing education credits for webinars. We host these monthly, and it is a great opportunity to level up your coaching skills. What makes YourCoach truly unique is that we are the only behavior change operating system that is powered by health and wellness coaches. We're partnering with organizations across various industries to demonstrate the value that health coaching can bring to their clients, members, and talent. By connecting individuals with validated and verified coaches who practice on our YourCoach platform, we're providing personalized support to help those clients achieve their goals. At YourCoach, our mission is to create a world where every individual has access to a health coach by 2030. In short, to help create more happy and healthy humans, and that's why we're here today. So let's go ahead and dive in. Because happy and healthy humans prioritize mental health. Mental health is essential for our overall health and well-being and quality of life. It refers to everything from emotional, psychological, and social well-being, and it affects how we think, feel, and behave. Mental health influences how we handle stress, how we make decisions, form relationships, and cope with life's challenges. Good mental health is necessary for individuals to thrive and to reach their full potential in all areas of life, including work, relationships, and personal growth. It also contributes to physical health, as mental health problems can cause or even exacerbate physical health conditions. We also have to consider the prevalence of mental illness. Mental illnesses, unfortunately, are quite common in the United States. According to the National Institute of Mental Health, nearly 1 in 5 adults in the United States, that's approximately 51.5 million people, experience some form of mental illness in a given year. These illnesses can significantly impact a person's quality of life, their relationships, and their ability to function in daily life. There's also an economic impact. The National Institute of Mental Health estimates that mental health costs the US economy more than $300 billion per year in lost productivity, healthcare costs, and other expenses. Unfortunately, there's also a little bit of stigma and discrimination in there. There's a stigma attached to mental illness that can help or prevent people from seeking help or speaking openly about their struggles. This can result in individuals not receiving the care they need, which can lead to a worsening of their condition. Access to mental health care can also be a challenge for many Americans. There are often significant barriers to accessing mental health services, including things like costs, lack of insurance coverage, a shortage of mental health professionals in certain areas, and most importantly, a world full of healthy and happy humans. We want this so bad, and mental health is so crucial to it. Research has shown that coaching can be effective in improving mental health outcomes, particularly when integrated with traditional mental health treatments. So let's dive right into it. What is a mental health condition or disorder? A mental health disorder is characterized by a clinically significant disturbance in an individual's cognition, emotional regulation, or behavior. It's usually associated with distress or impairment in an important area of functioning. There are many different types of mental disorders. Mental disorders may also be referred to as mental health conditions. The latter here, that mental health conditions, is a broader term that covers mental health disorders, psychosocial disabilities, and other mental states associated with significant distress, impairment in functioning, or a risk of self-harm. According to the National Institute of Mental Health, an estimated 51.5 million, I have to repeat that because it is such an astounding number of adults in the United States, that's approximately 20% of the population, experience mental illness, and that's in any given year. Anxiety disorders are the most common mental health challenges in the United States, affecting 40 million adults. That's again about 19.1% of the population. Major depressive disorder affects approximately 17.3 million adults in the United States. It's about 7.1% of the population annually. Bipolar disorder affects approximately 7 million adults in the US, which is about 2.8% of the population of adults, and about 4.4% will experience the disorder at some point in their lives. This number was really surprising to me. I don't know, maybe surprising to you too. I was kind of expecting the anxiety and the depression numbers to be high. I've seen those previously, but I hadn't seen actual stats on bipolar disorder before. And then eating disorders affect approximately 30 million Americans, which is about 10% of the population. And about 13 million Americans will have PTSD, that post-traumatic stress disorder, at some point in their life, which is about 3.6% of the population. Now, when we take all of this together, nearly 1 in 5 Americans live with mental health conditions in any given year, and almost half, that's 50% of Americans, will have mental health conditions at some point in their lives. And half of those will experience a mental illness by the age of 14. As a mom, this number broke my heart. Mental illness is more common among women, people of color, and members of the LGBTQ+ community. And most people who experience mental illnesses do not receive treatment, and many people don't even know that they have a mental illness. It can take years from the time mental illness appears to the time it gets diagnosed, if it gets diagnosed at all. It's important to acknowledge that while our scope as a health and wellness coach remains the same, regardless of what health condition we're working with, knowing the nuances of each of these can be immensely impactful to recognizing when a client can benefit from another member of the care team and what resources we could leverage in that moment. Also, while we will cover each of these in our time together today, it is an overview, and we could probably do an hour-plus long webinar on each of these health conditions. So now that we know what the health conditions are, where do they come from? There's nothing that we can say causes them, but there are certain things that are risk factors. So it's going to be things like genetics. Mental illness often runs in family lines. The environment. Living in a stressful environment can strain your mental health. Things like living in poverty or having an abusive family put a lot of stress on your brain and often trigger mental health concerns. Also stressful events, things like losing a loved one or being in a car accident. Childhood trauma. Even if you're no longer in a stressful environment, things that happen to you as a child can have an impact later in life. Complex PTSD is one of the particularly common mental health conditions among people who grew up in an abusive or neglectful environment. Negative thoughts, constantly putting yourself down or expecting the worst can get you stuck in a cycle of depression or anxiety. Unhealthy habits like not getting enough sleep or not eating. Drugs and alcohol. Abusing drugs and alcohol is just bad for your mental health overall and also for your physical health, right? It can make it harder to recover from mental illness and be harder on you physically. And of course, brain chemistry. Mental illness often involves an imbalance of natural chemicals in your brain and your body. So the question we always get, coaching versus therapy. So I thought it'd be helpful for us to take a moment and just talk about some of the similarities and differences because they're two complementary but distinctly different modalities. So a recent 2022 longitudinal observational study that was conducted during the COVID-19 pandemic shows that coaching is comparable to therapy in patient relationships and outcomes. Doesn't mean they're the same, but that is encouraging news. According to the study, both groups that use teletherapy or telecoaching services through an employer-sponsored mental health solution reported high ratings and similar results in terms of the therapeutic alliance. Similarities between coaching and therapy include things like positive psychology. Both health coaches and psychotherapists lean on learnings from positive psychology, where the focus is on the possibilities rather than the causes and issues. They might both leverage mindfulness. Both health coaches and psychotherapists can propose this practice to reduce stress, depression, anxiety, or even pain. We both use motivational interviewing, sometimes known as OARS as well. It's an evidence-based approach to behavior change and a guiding communication style. It's designed to strengthen that personal motivation and commitment to a specific goal by empowering that person's reason for change within an atmosphere of acceptance and compassion. Again, this is a really relevant tool that we use a whole lot as coaches, but also psychotherapists use this a lot. There's a strength-based focus. It comes from positive psychology, and it focuses individuals on self-determination and positive qualities, motivating and supporting them when challenges appear. We might both leverage solutions-oriented focuses. So according to psychoanalyst Michael Bader, there's an understanding that therapists work with the past while coaches work with the future. In Bader's opinion, good psychotherapy may be short-term and have very clear goals, both behavioral and emotional, which makes it similar to goals-oriented coaching. Not exact, but similar. Professional conduct and ethics. So both health coaches and psychotherapists hold to professional standards, principles, and ethics. Mental health professionals must be licensed by a regulating body, and board-certified health coaches follow the code of ethics from the National Board for Health and Wellness Coaching. Now, there's a lot of similarities, but there's also some very distinct differences. And those include things like structure. So in psychology, as well as health coaching, the individualized approach and flexibility in the workflow is essential, but there are some core differences. In health coaching, the client always knows what comes next. They know the session flow, they know what's coming up, they're in control of the process. Goal setting techniques and action plans are the foundation of a coaching program. In contrast, in psychotherapy, each session can look a little bit different depending on what is covered and what the goal of the session is. A lot of times, the psychotherapist is in control of the session versus in coaching where it's the client. Also, psychotherapy diagnoses and intervenes, while coaching evokes and mentors. According to the American Psychological Association, psychology's main purpose is to understand the behavior. Psychotherapists diagnose and identify issues and conditions to be managed in therapy. They're carriers of essential and expert knowledge that can be shared with clients working with any kind of mental health condition, depression, trauma, various disorders, abuse. In health coaching, we're a non-clinical profession. Partnership and mentorship are key components of that methodology. The client is the expert, which puts the coach in a non-authoritative position. Coaches focus on facilitating the client's accountability process and defining their goals and action steps. Education and training. There's a significant difference between the length, intensity, and methodology and training between health coaches and therapists. While psychotherapists hold at least a master's degree and hours of supervised clinical interventions, health coach training varies vastly. It can be from 6 weeks all the way up to a graduate program. And of course, establishing trust and boundaries. Since therapists work with clients affected by a variety of mental health conditions, it's essential to help the person reduce the distress so it's able to emerge with a new order. And that's a quote from the American Psychology Association. So seeking and establishing a comfort zone and working within it is compulsory. Health coaches, however, are in their non-clinical role, and they may push clients outside of their comfort zones gently by asking powerful and direct questions while remaining attentive, empathetic, and sensitive. Of course, once that trust is obtained and established. So when working with clients with mental health concerns, somatic and or psychological symptoms, relational problems, things like past traumas can be observed, and we can address them carefully and empathetically, and we're going to talk about how to do that, but not profoundly explored and diagnosed. While we may have similar tools that psychologists use that we can use as coaches, we have to remember that their toolbox is much larger and much more expansive. They have additional tools, skills, and modalities that they can leverage. Our favorite saying, when in doubt, refer it out. So let's talk about that scope really quickly, and then we're going to dive into all of those specific mental health conditions. So according to the National Board for Health and Wellness Coaching Ethics, health and wellness coaches are not licensed mental health professionals. Hopefully we're all comfortable with that and know that. And we're not trained to diagnose or treat mental health disorders, but we can help clients with certain mental health conditions within scope of our practice, which is to support their behavior change and enhance overall well-being. So things we can help with. First, we have to look at the client themselves. Does the client understand the scope of practice, and are they comfortable working within it? Do they seem to have a move forward attitude, and are they able to function at a baseline daily? If they're not able to function at that baseline daily, are they currently working with a clinician and understand how health coaching fits into that care team? Stress management. We can help clients identify sources of stress in their lives and coping strategies to manage them. We can also teach relaxation techniques and mindfulness practices to promote overall well-being. There's, of course, lifestyle changes for depression and anxiety. We can support clients in making those changes and improve symptoms of depression and anxiety. Things like regular exercise, healthy eating habits, and social support can be really, really therapeutic in that sense. Goal setting and motivation. We can help clients set realistic goals and stay motivated to achieve them. And that can be really helpful for individuals with mental health conditions that impact their motivation and their energy levels. Self-care practices. We can educate clients on self-care practices such as good sleep hygiene, mindfulness meditation, and other relaxation techniques that can improve mental and emotional well-being. And of course, building resilience. We can help clients build resilience to stress and adversity, which can be particularly helpful for individuals with mental health conditions that impact their ability to cope with challenges. Now, if we move into areas that are outside of our scope of experience, here's some signs with a client that might indicate that the client themselves might not be a good fit for our scope of practice, or we might need additional support from the care team. So, decline in experiencing positive emotions, increase in hopelessness or helplessness, changes in energy levels such as hyper-alertness or excessive tiredness, behaviors that indicate impulsiveness, risk-taking, or substance abuse, thoughts of suicide or death, increased irritability or outbursts, a desire to repeatedly process feelings rather than progressing towards learning and insights. Now, again, in any isolated case of one moment where maybe they show a little bit of hopelessness, that's not necessarily a contraindication to coaching. We're looking at trends over time. Now, any kind of suicidal ideation, obviously on the scale, that's going to be much more serious and something we definitely want to get them connected to another resource. Also, psychotherapy, we talked about this, diagnoses and intervenes, while coaching evokes and mentors. So we wouldn't want to diagnose or treat anything. We don't recommend or sell supplements or medication. This can be a direct conflict, not only of the code of ethics for health coaches, but also could be a direct defiance of state or national laws in some cases. And this goes right along with that. We don't give nutritional or exercise plans specifically to a client. While we can give them resources that point towards healthy lifestyle behaviors, we would not tell the client exactly what to eat, when to eat it, or what exercises to do. Even if you have alternative certifications or licenses, as long as you're wearing that health coaching hat, we need to stay within the scope of one, or we need to advise our client we are moving into the scope of another one of our licenses and they need to work with you in that capacity. And of course, prescribe. In health coaching as a non-clinical profession, partnership and mentorship are the heart of it. The client's the expert. We're in a non-authoritative position and we can't intervene. Psychotherapists diagnose and identify issues and conditions to be managed in therapy, and they can intervene with a client with more complex mental health concerns, and of course we can't. So let's dive into our first mental health condition. We're going to talk about anxiety, because anxiety is one of the most common, it actually is the most common mental health concern within the United States. In 2019, there were 301 million people worldwide living with anxiety disorders. That includes 58 million children and adolescents, and approximately that makes for 1 in 5 American adults. Anxiety disorders are characterized by excessive fear and worry, resulting in behavioral disturbances. These symptoms can cause significant distress or impairment in functioning. There are various types of anxiety disorders, such as generalized anxiety disorder, panic disorder, social anxiety disorder, and separation anxiety disorder. Effective psychological treatments are available, and medication may also be considered depending on the age and severity of the condition. Now, remember that medication would be available from their clinician, either their physician, their psychotherapist, from any kind of clinical role, not from us as health coaches. According to Mental Health America, anxiety disorders are the most common mental health condition. 1 in 4 adolescents lives with anxiety, so a little bit more common than even with adults. Again, as a mom of teenagers, like this just breaks my heart. Women are also more likely to experience anxiety disorders, except for social anxiety and obsessive compulsive disorder, which affect men and women equally. It's common to experience multiple anxiety disorders at once and to have anxiety along with other mental health conditions, especially depression. However, only 1 in 3 people with anxiety disorders will actually receive treatment for it. So common symptoms of anxiety disorders include things like feeling restless, irritability, difficulty concentrating, muscle pain or tightness, soreness, trouble sleeping, or even staying asleep, fatigue, avoidance of anxiety-provoking situations, and intrusive thoughts. The most common types of anxiety disorders in the US are phobias. You'll see the little chart here on the right that outlines that 8.7% of the US population has some kind of phobia. So fear of heights, I totally resonate with this one. That one hit me standing on the edge of the Grand Canyon. So we all have something, some people it's spiders, but phobias are very common. And then it goes all the way down to that obsessive compulsive disorder. For people who have anxiety, the symptoms cause serious problems in their lives. Difficulty concentrating can make it hard to do well in school or at work, and many people take extreme measures to avoid situations that might trigger their anxiety. They might isolate themselves from others, they might avoid public spaces, they may change their daily routines. Anything that they can do to avoid whatever is making them anxious. Stress and anxiety share physical symptoms. So this is really important to know because most of us experience stress at some point or even regularly. So they share some physical symptoms, but stress is a normal reaction to external pressures, while anxiety is characterized by apprehension and unexplained thoughts of doom. Prolonged stress that interferes with daily activities could indicate an anxiety disorder. So what tools do we have in our coach's toolbox to support clients with anxiety? Evoking. Evoking is an integral part of a health coaching session. It even takes up the bulk of it when we look at coaching structure, right? But it's really important for a client who has anxiety because it allows the coach to help the client explore and express their thoughts and feelings and gain a deeper understanding of their anxiety triggers and patterns. By evoking, the coach is encouraging the client to reflect on their experiences and their emotions and to identify any barriers or challenges that may be hindering their progress. This process can really help the client become more self-aware and better equipped to then manage their anxiety going forward. We could use a balanced time perspective. So time perspective coaching encourages clients to be acutely aware of events that are happening around them and be an active participant. In time perspective coaching, the past is divided into past negative and past positive, and the present is divided into present positive and present negative. If any of these perspectives is weighed too heavily, clients are unable to focus on what's happening right now and may feel insecure about the future. When anxiety centers around fear of future events, time perspective coaching can help clients to realize how their anxiety is impacting them. The first step might be to encourage clients to think about what their future best self looks like by starting a diary to journal their thoughts and emotions. And then we can go into how they can control what happens next. Having this mindset can help reduce your client's anxiety that manifests from making those future choices. It also allows your client to feel supported while they're navigating how to align their chosen actions with their core values. We can also lean into self-determination theory. So self-determination theory focuses on the kind of conditions that motivate people to do well and feel good throughout the course of their lives. More specifically, self-determination theory looks at what motivates individuals to set goals and discover their purpose with the ultimate goal of achieving autonomy. Coaches can help clients meet these needs and their goals through focusing and developing personal strengths. We can also utilize a self-care brainstorm. Brainstorm with your client a list of ways that they can practice self-care. Think about all the dimensions of care: physical care, emotional care, spiritual care. You can even create different lists for each. Self-care is an excellent way to help combat anxiety as it allows the client to focus on their needs as opposed to their worries. We can also leverage a vision board or exercise that gives clients the opportunity to plan where they're going to be in 3 months. This gives them the opportunity to plan long-term goals and remain hopeful for the future. And side note, we do have a vision board exercise within the coach's resource folder in the platform, so definitely check that out. Now, signs that your client may need additional support. Anxiety symptoms interfere with their daily life. They're not able to function and go about their day or their needs and commitments in the day. The client expresses wanting or needing additional support, or they begin to deal with anxiety through an unhealthy coping mechanism such as substance abuse. Those definitely would be some key indicators that they need additional support in another care team member. So let's look at our first case study, Samantha. Samantha is a 34-year-old marketing professional who has been struggling with anxiety for several years. She experiences frequent episodes of panic attacks, which have impacted her ability to perform well at work and enjoy her personal life. She's tried medication and therapy in the past, but has not found significant relief. So as her health coach, we could work with Samantha to develop a personalized plan for managing her anxiety. This could include identifying triggers for her panic attacks, experimenting with coping mechanisms for when she feels anxious, and finding ways to incorporate relaxation and self-care practices into her daily routine. We could educate Samantha on the importance of healthy lifestyle and managing anxiety. This could include discussing the role of nutrition, exercise, sleep, stress management techniques, all the different things that support overall well-being. We could also help Samantha explore alternative treatment options for her anxiety. This might involve encouraging her to work with her healthcare provider to try different medications or therapies. Again, we're not suggesting anything, we're letting Samantha take the lead on this. Or we could explore complementary therapies such as acupuncture, massage, or mindfulness-based stress reduction. When she shares that medication and therapy have not provided relief in her past experience, We could even say something like, I hear that you've tried medication and therapy in the past, but haven't found significant relief. That can be incredibly discouraging and make it difficult to keep searching for solutions. I want you to know that we'll work together to explore options and create a plan that feels manageable and effective for you. We'll take things one step at a time, and I'll be here to provide support and guidance every step of the way. Seeking additional support can be a sign of strength, and I'm here to help you find the resources you need to manage your anxiety. Do you have a sense of what the next step might be? With that, once trust and rapport are built, we could further encourage Samantha to seek support from mental health professionals, maybe one who specializes in anxiety disorders. A licensed therapist or counselor could provide her with additional tools and strategies for managing her symptoms, as well as emotional support and guidance. So this could even sound something like, dealing with anxiety can be challenging and impact many areas of our lives. I want to support you in finding strategies that work for you to manage your symptoms and improve your overall well-being. We'll work together to navigate this journey toward finding relief from your anxiety. In addition to exploring lifestyle changes, such as incorporating exercise and mindfulness practices, it may be helpful to consider speaking with your healthcare provider about other treatment options or complementary services. I want you to feel empowered to make the best decision for your mental health. And of course, provide ongoing support and accountability to help Samantha stay on track with her goals and make progress towards managing her anxiety. This might involve regular check-ins, goal-setting sessions, or connecting her with a peer group online or an online community for individuals with anxiety disorders. Lots of directions we can go to help Samantha. All right, next up, let's chat about how we can support our clients struggling with depression. In 2019, 280 million people worldwide had depression, including 23 million children and adolescents. In the US, 1 in 10 adults struggles with depression. Depression is a mental illness that goes beyond the usual mood changes and short-lived emotional reactions to everyday challenges. During a depressive episode, the person experiences depressed mood or a loss of pleasure in activities for most of the day, almost every day, for at least 2 weeks. Now, common symptoms might be feeling or appearing low, excuse me, empty inside, or irritable most of the day, every day. Maybe losing interest in activities that you would normally enjoy. Changes in appetite or weight, eating more or less, gaining or losing weight. Changes in sleep, either not being able to sleep or sleeping too much. Changes in activity, feeling restless inside or feeling sluggish. Feeling exhausted, even when you seem to be getting enough sleep. Speaking or moving slowly, fidgeting or pacing, feelings of worthlessness or guilt, and difficulty thinking, concentrating, or making decisions. And unfortunately, thoughts of death or suicide. People with depression are at an increased risk of suicide. Although 4 times as many men than women actually commit suicide, women attempt suicide more often. I think it's worth noting here that some things can make it seem like you have depression when really something else is going on. So for example, if a client is starting to take new drugs or medications that make them feel low, it could be causing symptoms of depression. They could also suffer from medical problems like chronic pain or thyroid problems, or perhaps it's from something like grief. Goodness, guys, I'm so sorry. If they've lost a loved one or they're upset about a big change in their life, they can feel extremely sad for a while. And if it doesn't get better for a long time, somewhere more than like 2 months, it can turn into a full-blown depression though. So it's worth noting that nothing singularly is going to point to a diagnosis. We wouldn't diagnose anyway, that's on somebody else. But there can be other things that are happening that might cause some of these symptoms, even though it's not depression. So what tools are in our coaching toolbox can we pull out to support clients with depression? Lots of things. Let's just cover a few of them. So of course, meditation and or a mindfulness technique. Mindfulness can be a powerful tool for managing depression. Mindfulness techniques such as meditation or deep breathing exercises can help clients develop a greater awareness and control over their thoughts and emotions. We can also do gratitude journaling. Keeping a gratitude journal where they write down a few things they're grateful for each day can help shift their focus towards the positive aspects of their life and then help improve their mood. Self-care. Self-care is always a great idea. Depression can be a debilitating condition though, and it really affects a person's ability to function and enjoy their life. It can lead to feelings of worthlessness, hopelessness, and fatigue that really make it difficult to engage in those everyday activities. And so self-care can help to counteract those negative effects by promoting physical, emotional, and mental health. Eating a healthy and balanced diet can also provide the body with the nutrients it needs to function optimally, and that also supports emotional well-being. Other forms of self-care, such as getting enough sleep, practicing relaxation techniques, engaging in hobbies, spending time with loved ones. My personal favorite, reading a book in the hammock in the background or in the backyard. All of these can help to improve mood, reduce stress, and increase resilience. Self-care can also help to build self-esteem, which is often diminished in those clients that are struggling with depression. We also can work with them on physical activity. Regular exercise has shown to be an effective tool for managing depression, as it releases those magical endorphins, which are natural mood-boosting chemicals that can help to reduce symptoms of depression. So we can work with our clients to find ways to engage in physical activity that they enjoy, things like walking, swimming, or yoga. We can also use a love and loathe list. This is used to identify activities that either help to improve their mood or maybe contribute to their feelings of depression. Someone with depression can create a love and loathe list by making 2 columns on a piece of paper in a notebook. In that love column, they're going to write things that make them feel happy, feel calm, fulfilled. And then in the loathe column, they list things that make them feel anxious, sad, maybe overwhelmed. Then this list can be used as a talking point, a starting place, as a reference for making intentional choices in their day-to-day life. This way they can incorporate more of those things from their love list and minimize activities from their loathe list. And it can be a really useful tool for promoting mental health and well-being, increasing that self-awareness and supporting recovery. Now, signs that your client may need additional support are when those depression symptoms interfere in their daily life, any kind of suicidal ideation, client expresses wanting or needing additional support, or they begin to deal with depression through an unhealthy coping mechanism. All right, we're going to check in on our next case study. Y'all ready? Let's meet John. John is a 45-year-old executive who has been struggling with depression for several years. He has tried various treatments, including medications and therapy, but he's not found significant relief, as he frequently forgets his medication. And although his therapist has great suggestions, he is not having success implementing them into his routine. John's not alone, right? So we would want to approach John and his case with empathy and understand that living with depression can be really challenging and really exhausting. We could work with John to develop a personalized plan to manage his depression symptoms, and that could look like things like discussing lifestyle changes he could make to support his mental health, things like incorporating regular exercise, healthy eating habits, and stress management techniques into his daily routine. It's important to identify any red flags or signs of suicidal ideation or harm to self or others. So we would want to be sure to watch for any concerning behavior and encourage John to seek immediate medical attention if needed. We'd also want to be aware and ask about any medication or treatment changes John is making, provide resources and support to ensure he's safely and effectively managing his depression, and look for or reflect signs back to him of anything that we notice, such as social withdrawal or substance use. It's crucial to address any potential barriers to success, such as those he mentioned, right? He mentioned he's forgetting his medication and he's having difficulty implementing the therapy suggestions. So we would want to work with John to identify practical strategies to overcome those obstacles. So that could sound something like, man, living with depression can be really tough, and I want to acknowledge how hard you're working to manage your symptoms. It's important that we find strategies that work for you and that you feel confident in implementing. Let's explore different ways to create consistency with your medication and how we can make the therapy suggestions more feasible for you to incorporate in your daily routine, which feels like the best place to start. And then we could work with him to implement them one at a time in a way that is actually meaningful and helpful to his daily routine. Overall, my goal would be to support John in his journey towards managing his depression symptoms effectively and to help him feel empowered and motivated to continue down his path. All right, next up, we're going to chat about and transition into bipolar disorder. Now, bipolar disorder is a mental illness that causes extreme mood shifts. This can range from depressive lows to manic highs. People with bipolar disorder are at an increased risk of suicide, but effective treatments do exist, such as psychoeducation, stress reduction, social functioning improvement, and even medication. Approximately 1 in 40 American adults and 1% of American teenagers live with bipolar disorder. It affects men and women equally, and it does tend to run in families. Misdiagnosis with other conditions is really common, and it can even take up to 10 years for a correct diagnosis. That just is crazy. That's such a long time. Despite being less common than depression and anxiety, bipolar disorder is the 6th leading cause of disability worldwide, and many people with the disorder also struggle with addiction. So when we look at them, we have these two phases, right? So mania often includes things like being abnormally upbeat, jumpy, wired, increased activity, excessive energy, having a decreased need for sleep, an extreme high or euphoric feeling, exaggerated sense of self-confidence, unusual talkativeness, rapid speech, racing thoughts, distractibility, and uncharacteristically poor judgment. This could be things like spending sprees, reckless driving, foolish business ventures, or taking sexual risks. Now, it's important to note that these are drastic changes from what a person is typically like. If a person always speaks quickly, makes impulsive decisions, and doesn't sleep much, then they aren't signs of a manic episode. They are just personality traits, or they could be signs of another mental health condition such as ADHD. Now, phases of depression may include things like persistent sadness, anxiousness, or an empty mood, fatigue or a loss of energy, difficulty concentrating, remembering, or making decisions, a lack of interest in normal activities, changes in sleep, irritability or restlessness, feeling guilty, hopeless, or worthless, or thoughts of suicide or death, including suicide attempts. So sorry about my coughing, guys. I think I need more water. Here we go. So that's a lot. That is a very heavy thing to carry as a coach if you're working with a client, but coaches have an immense opportunity to support these clients. So what coaching tools could we use with a client with bipolar disorder? We can work with them on routine building. The benefits of routines for clients with bipolar disorder are so great that it is scientifically shown it can result in reduced cycle changes that flip from manic to depressive episodes, according to a study led by clinical psychologist Ellen Frank. Now, that study showed that regular routines help prevent new depression and manic cycles longer than those who just took medication. We can also work with them on nutrition, exercise, and healthy lifestyle habits. A healthy diet will give the body proper nutrition. Exercise can help support improved mood. Healthy body helps with healthy mind. Medication adherence plans. So mood stabilizers, antipsychotics, antidepressants. There could be a myriad of medications that this client could be taking to help manage their mood swings and other symptoms. So having a plan that helps them remember to take their medicine on time and to be part of their daily routine can be hugely impactful. We can also work on mood tracking and journaling. By tracking how they feel day to day, the client can notice triggers, monitor how their treatment's working, and spot changes in their eating or sleeping patterns. This written information can be especially helpful for their doctor or their clinician. Communication skills development. This can help them educate their loved ones about bipolar disorder so they can best support them. They could even leverage their support network to help them recognize the warning signs of manic or depressive episodes. And so being able to communicate those things clearly and have the confidence to do so can be really impactful. We can also work on coping skills development. Relaxation techniques such as deep breathing, meditation, yoga, and guided imagery can be really effective at reducing stress and keeping moods on an even keel. Now, signs your client may need additional support. If they're currently in a manic or a depressive episode, they're not a good candidate for coaching at that moment. We need to refer them to their clinician, and that would be completely appropriate in that time. Inability to commit to the coaching process. Again, suicidal ideation. If the client expresses wanting or needing additional support, if they have confusion on your scope of practice and they are seeking to replace their clinical team versus just complementing their clinical team, then this could be a conversation about how they might fit into coaching or not. So let's meet Susan. Susan is a 40-year-old woman who is diagnosed with bipolar disorder at the age of 30. She has been receiving treatment from a psychiatrist for the past several years and has made progress in managing her symptoms through medication and therapy. However, Sarah feels that she could benefit from additional support, but isn't sure where to start. So as coaches, our primary intention for Susan is going to be supporting her in developing a plan to, of course, overall enhance her well-being and manage her symptoms, challenges, and concerns associated with her bipolar disorder. We could start by acknowledging the process she's already made in managing her symptoms, and we could also empathize with the challenge of finding another support. We could work with other members of her care team to collaborate and build the best support system around her. Now, it would be important to be aware of some concerning behaviors, so things like mood changes. Of course, bipolar disorder is characterized by extreme mood swings, but it's important to keep an eye out for any changes in Susan's mood that may indicate a shift in her mood state. Also changes in medication or therapy. So if Susan makes any changes to her medication or therapy routine, it would be important to have her communicate those changes and how they may be affecting her. So we can help support her through that, right? So not that we are going to suggest any changes if things are not working out well with her, but we could work with her on communication with her clinician, or we might be able to help her manage some of the side effects through that time. And then risk of self-harm. So obviously individuals with bipolar disorder are at an increased risk of self-harm. So it's important to be aware of any signs of suicidal ideation or self-injury. Together, we could explore various lifestyle factors that impact her mental health, diet, exercise, stress management, all of those usual pillars we can lean on, and support her in developing a self-care routine that includes activities she enjoys, such as mindfulness practices, yoga, or other forms of physical activity. Now, given Susan's history of successful treatment through medication and therapy, we could also explore together additional complementary approaches that could enhance her overall well-being. So an example of that could be, we could explore the idea that Susan consider working with a registered dietitian to develop a personalized nutrition plan that supports her mental health. If she comes to you and expresses that that's something that she wants to do, we could help put those plans into motion to get her connected and help her have all the tools that she needs to start that. We could also explore the benefits of various things like acupuncture or massage that might help reduce stress and improve overall well-being. Now, given that she's expressed a need for additional support, we'd explore that idea maybe about a support group, something that could provide her with additional emotional support. We could ask questions to understand what kind of additional support she could see herself engaging in. So like support groups in person, maybe online. And that could sound something like it's completely normal to feel unsure about where to start when it comes to finding additional support for your bipolar disorder. Let's work together to explore some options and find the right fit for you. What does this additional support look like to you? What can you see yourself doing or engaging in? And then we could start that conversation together. So let's move into transition over to PTSD, post-traumatic stress disorder. I know we're moving through these pretty quick, but I wanted to make sure to touch on each of these because they're each so important. And honestly, something you are likely to come across regardless of what kind of health and wellness coaching that you do. Now, PTSD is a mental health disorder that may occur in people who have experienced or witnessed a traumatic event, series of events, or set of circumstances. An individual can experience this as emotionally or physically harmful, could be life-threatening, but it might affect mental, physical, social, or even spiritual well-being. PTSD has been known by many names in the past. During the years of World War I, it was called shell shock. During the period of World War II, it was called combat fatigue. And so we tend to associate it with our veterans. But PTSD is not exclusive to veterans. PTSD can occur in all people of any ethnicity, nationality, culture, at any age. PTSD affects approximately 3.5% of the US adults every year, and the estimate is that 1 in 11 people will be diagnosed with PTSD in their lifetime. Women are also twice as likely as men to have PTSD. And 3 ethnic groups, US Latinos, African Americans, and Native Americans or Alaska Natives are disproportionately affected and have higher rates of PTSD than non-Latino whites. So some symptoms of PTSD are repeatedly thinking about the trauma. Thoughts about the trauma may come to mind at surprising or inconvenient times. The client might have nightmares or flashbacks about the event. They might be constantly alert or on guard, easily startled, easily angered, irritable, anxious, preoccupied with staying safe. They might become hyper aware of their surroundings and see danger everywhere. Avoiding reminders of the trauma. They may not want to talk about the event or be around people or places that remind them of the event. They may even forget details about the event or suppress their memories. There could be intense negative emotions and beliefs. So they might feel depressed, anxious, guilty, angry. They may blame themselves for the trauma or believe that no one can be trusted. They might also feel emotionally numb or have trouble concentrating or sleeping. They might lose interest in activities that they normally enjoy. Relationship problems, having problems with intimacy or feeling detached from family and from friends and from loved ones. They might have physical symptoms such as chronic pain, headaches, stomach pains, diarrhea, tightness, burning in the chest, muscle cramps, low back pain. So it's not just a mental condition, it can manifest in a physical way too. There might be panic attacks. That's that sudden feeling of intense fear, and it seems totally unrelated to the event, but you have shortness of breath, dizziness, sweating, nausea, and racing heart. It might be substance abuse problems, so using drugs or alcohol to cope with, or even some cases forget the emotional pain. Now, it's important to remember most people who experience a traumatic event have symptoms like this for a few days after the event. But for people with PTSD, symptoms last for over 1 month and it interferes with daily life. So what kind of coaching tools can we use with a client suffering with PTSD? We can use a pro-con list. Sometimes people feel they have a good reason to be angry, anxious, or sad. They don't want to let those feelings go. However, these negative thoughts and feelings may be getting in the way of moving on with their life. So finding the pros and cons to keeping a negative thought can make us more open to adjusting our thought, which could make us feel better. We can also use reframing. Reframing is a really helpful way to turn problems or negative thoughts into opportunities for change and growth. We can use mindfulness. Research suggests that mindfulness-based programs can provide relief from PTSD symptoms such as anxiety, sleep disturbance, and difficulty concentrating. We can also work on stress reduction. Relaxation techniques such as meditation, deep breathing, massage, or yoga can activate the body's relaxation response and ease symptoms of PTSD. Of course, a lifestyle assessment can be great. Understanding how lifestyle factors affect the symptoms of PTSD can be empowering to help the client feel more in control and make decisions with confidence. Things like getting enough rest, eating a healthy diet, exercising, taking time to relax, all of these can help manage their symptoms. And of course, a strengths assessment. It's easier and more effective to build upon something that already works to some extent. A strengths-based approach helps people identify how they are already trying to cope and then builds on that. There are two types of strengths that are both equally important. We can do the prevention and resilience strengths, or what do you do on a daily basis to help stay healthy and happy? And then we have intervention and coping strategies or strengths. And that's where we can ask things like, in the past, when you felt this way, what helped? What made it worse? We can explore it from that angle. Now, signs that your client may need additional support. PTSD interferes with daily activities. The client wants to discuss the event that caused the PTSD repeatedly. We don't want to get stuck in that cycle that definitely falls more into a psychotherapy realm. You find yourself accidentally triggering the client through your words or actions, or of course, suicidal ideation. So our case study, Mark. Let's meet Mark. Mark is a 50-year-old veteran who has been diagnosed with PTSD. He experiences frequent flashbacks, nightmares, and anxiety, which have impacted his ability to function well in his personal and professional life. He is embarrassed to seek help from a therapist, so he engaged with a health and wellness coach. This plays into that stigma that we sometimes see. Now, understanding that PTSD is a complex condition and it can significantly impact an individual's quality of life, we want to approach this coaching relationship like we do all of them, with sensitivity and empathy, and particularly in this case, those two towards Mark's military service and what led to living with PTSD. We'd want to be aware of potential concerns like substance abuse, what his triggers are, and any tendencies to isolate. It's normal and to be expected that Mark may not want to open up about this until rapport is established. So to do that, we want to make sure to provide emotional support and create that safe space for Mark so that he can open up and share his experiences and feelings. Taking the time to create a very safe and connected relationship is going to be essential in this case. And we want to really get curious about who Mark is. What type of activities does he enjoy? Who in his life is supportive? And as we get to know him, all of this can lead to great discussions that tie these aspects into the conversation. And then we can work together to discover and develop coaching mechanisms to manage his symptoms. So things like deep breathing exercises, grounding techniques, mindfulness practices, anything like that. These techniques can really help Mark feel more in control of his emotions and his reactions. Now, of course, we could also support Mark to continue to seek professional medical help and support, such as working with a therapist who specializes in PTSD. We could explore different resources and referral options together, such as veteran support groups or PTSD treatment programs. We could help him identify lifestyle changes that could benefit his mental health and well-being. Again, these are all of our wellness pillars that we talk about: regular exercise, healthy diet, good sleep. And all of this can have a positive impact on PTSD symptoms and overall health. Now, we absolutely can support him in managing his symptoms while also still empowering him to seek the professional medical help he might need, and understanding that he does see this with stigma around it and may not be quite ready yet. That's where building that rapport and having that trust first becomes so essential. It's like that old adage we used to hear all the time about people don't care what you know, or oh my goodness, I just flipped that one. People don't care what you know until they know you care. So we want to show Mark that we are invested along this journey with him. So we could say something to him like, I understand that seeking help for PTSD can be difficult, but I want you to know that you're not alone. Together, we can work on developing coping mechanisms to manage your symptoms and explore different resources to support your healing. Additionally, lifestyle changes such as regular exercise, healthy eating, and good sleep hygiene can be beneficial to your overall mental and physical health. It's important to remember that seeking professional mental health is also a crucial part of your healing journey. As your coach, I'm here to support you every step of the way. What are some of the areas of lifestyle changes you're most interested in exploring? And then we can start to build that trust and continue that rapport with Mark. We're dropping these little breadcrumbs along the way. Now, finally, let's move into eating disorders. Eating disorders are behavioral mental health conditions characterized by severe and persistent disturbances in eating behaviors and associated distressing thoughts and emotions. These can be very serious conditions that affect physical, the psychological, and the social function. Types of eating disorders include anorexia nervosa, bulimia nervosa, binge eating disorder, avoidant restrictive food intake disorder, other specified feeding and eating disorder, pica, and rumination disorder. So it's a big, broad category. Now, taken together, eating disorders affect up to 5% of the population, most often develop in adolescence and young adulthood. Now, these are more common in women, but they can occur at any age, and they can affect either gender. So eating disorders are often associated with preoccupations with food, weight, or shape, and anxiety about eating or the consequences of eating certain foods. Behaviors associated with eating disorders include restrictive eating or avoidance of certain foods, binge eating, purging by vomiting, or laxative misuse or compulsive exercise. And these behaviors can become driven in ways that appear similar to an addiction. The most common eating disorder in the USA is anorexia nervosa. Anorexia nervosa is categorized by self-starvation and weight loss, resulting in low weight for height and age. Anorexia has the highest mortality of any psychiatric diagnosis other than opioid use disorder and can be a very serious condition. So a body mass index, BMI. I know we all have a love-hate relationship with BMI, but it is a good clinical marker and a measure for height and weight. So for anorexia nervosa, it's typically under 18.5 in an adult individual that's going to be diagnosed with anorexia nervosa. Now, symptoms of anorexia can include things like dramatic weight loss, dressing in layers to hide weight loss or stay warm, preoccupation with weight, food, calories, fat grams, and dieting, makes frequent comments about feeling fat or overweight, resist or is unable to maintain a body weight appropriate for their age, height, or build, and maintains an excessive rigid exercise routine despite weather, fatigue, injury, illness, doesn't matter. They have this excessive, very rigid exercise routine that they must stick to. Now, individuals with bulimia nervosa typically alternate dieting or eating only low-calorie safe foods with binge eating on forbidden high-calorie foods. Binge eating is defined as eating a large amount of food in a short amount of time, and it's associated with the loss of control over what or how much one is eating. Binge behavior is usually secretive and associated with feelings of shame or embarrassment, and binges can be very large, and food is often consumed rapidly beyond fullness to the point of nausea and discomfort. Binges occur at least weekly and are typically followed by what are called compensatory behaviors to prevent weight gain. So this is going to be things like fasting, vomiting, laxative misuse, compulsive exercise. So similar to anorexia nervosa, persons with bulimia nervosa are excessively preoccupied with thoughts of food, weight, or shape, which negatively affect and disproportionately impact their self-worth. Now, it's just important to remember bulimia then has that compensatory behavior on the flip side of it. So symptoms can include things like evidence of binge eating, including disappearance of large amounts of food in a short amount of time. That could be lots of empty wrappers and containers that indicate consumption of large amounts of food. Evidence of purging behaviors, infrequent or frequent trips to the bathroom after meals, signs and smells of vomiting, presence of wrappers or packages of laxatives or diuretics, drinking excessive amounts of water or non-caloric beverages, maybe even using excessive amounts of mouthwash, mints, or gum. Sometimes they have calluses on the back of their hands and knuckles from self-induced vomiting. And it could be dental problems, such as enamel erosion, cavities, discoloration of teeth from vomiting, and tooth sensitivity. Now, as with bulimia nervosa, people with binge eating disorder have episodes of binge eating in which they consume large quantities of food. Again, this is going to be in that brief period, and they experience that sense of loss of control over their eating, and they're often distressed by the binging behavior. So unlike people with bulimia nervosa, however, they do not regularly use compensatory behaviors to get rid of the food. So we have anorexia nervosa, which is going to be where they are underweight, and then they have the challenges with with food, with the type of food or shape of food, calories in the food, all those kinds of things, but they're going to be underweight. We move into bulimia, then we have that compensatory behavior that's on the backside. Binge eating is more about the action that is being taken. So symptoms can include things like secret recurring episodes of binge eating. So things like eating in a discrete period of time, an amount of food that's much larger than most individuals would eat under similar circumstances, really feeling that lack of control over the ability to stop eating, feelings of disgust, depression, or guilt after overeating, maybe feelings of low self-esteem. They may steal or hoard food in strange places or create lifestyle schedules or rituals in order to make time for those binge sessions. And evidence of binge eating, including the disappearance of large amounts of food in a short amount of time. And finally, we have what's called the otherwise specified feeding or eating disorder. This diagnostic category includes eating disorders or disturbances of eating behavior that cause distress and impair family, social, or work function, but they don't fit into any of the other categories listed. In some cases, this is because the frequency of the behavior does not meet the diagnostic threshold. So an example of that would be like the frequency of binges and bulimia or a binge eating disorder, or it may not meet the weight category for the diagnosis of anorexia nervosa. Symptoms of something that might fall into this category are frequent episodes, again, of consuming that very large amount of food, followed by behaviors to prevent weight gain, such as self-induced vomiting, evidence of binge eating, including the disappearance of a large amount of food in a short amount of time, self-esteem overly related to body image, dieting behaviors, such as reducing the amount or the types of foods consumed, expressing a need to burn off calories taken in, or evidence of purging behaviors. So what coaching tools can we use with clients with eating disorders? Of course, vision board and setting. Creating a vision board is a powerful reminder that there is a future without an eating disorder, and it is possible, and it helps clients envision what that future can look like. We could talk about joyful movement. Joyful movement is a way of approaching physical activity that emphasizes and focuses on pleasure. For those recovering from an eating disorder or disordered eating, one's relationship with movement may be influenced by toxic disordered thoughts and behaviors. By turning to their intuition as opposed to relying on external factors to dictate how they move their body, clients can learn to engage in exercise that's both enjoyable and good for them, physically and mentally. And of course, implementation of a clinician's healthy eating plan. It's one thing to know what to do, and it's another to figure out how to do it. Clients often need help figuring out how to weave their clinician's plan into their daily or weekly routine. We could work with them on a support system creation. When it comes to eating disorder recovery, people are dealing and healing with needing support, encouragement, guidance, empowerment from their support system, their treatment team, their recovery community. Relationships and connections are vital resources for achieving long-term eating disorder recovery and healing. Identifying risk factors in their lives. This can bring awareness and thus control to a client who has a history of eating disorders. Knowing the risk factors can help them improve or eliminate them by developing a plan to overcome them. And affirmations. As with any illness, there can be relapses and times where the client may feel like they're a failure. So learning to set good intentions followed by positive affirmations is a positive coping strategy that can help any individual overcome the patterns of negative thinking associated with those eating disorders. And it's been known to calm the mind and increase self-awareness and self-esteem. Now, signs that your client may need additional support, clients experiencing medical complications as a result of their eating disorder, clients unable to make changes in their life to move forward, or they're replacing their clinical team versus complementing them with health coaching. I know we're getting close to our end of time. This is our last case study, so just hang in there for just a few more seconds. Let's meet Emily. Emily is a 25-year-old woman. She's coming to health coaching to work on her diet and exercise. She tells you she has formerly been diagnosed with anorexia nervosa, but she's trying to find healthy ways to manage her weight. She struggles with self-confidence and still shows some concerning eating behaviors such as skipping dinner to help control her calories. Now, as her health coach, it's essential to acknowledge her bravery and seeking help. and then to working towards a healthier lifestyle. We can lift her up with praise for how far she's come, and we can give her that added support that she's seeking. Given her history of anorexia nervosa, it's important to approach this topic with sensitivity, with empathy, and with understanding. We could work together to implement her clinician's plan that promotes those healthy eating habits, or we could offer resources to help her plan her next steps. We could also explore different types of exercise that Emily enjoys and would feel comfortable engaging in. So this could sound something like, I hear you when you say you're struggling with self-confidence and still working through some concerning eating behaviors. Let's work together to find some strategies to help you feel more confident in your body and make healthy choices that feel good to you. Where's one area you'd like to begin? It's also important to address Emily's concerns about self-confidence and her body image. We can work together to identify and challenge negative thoughts and beliefs and develop strategies for self-care and self-compassion. Now, given that she does have a diagnosis and history of anorexia nervosa, and she's continuing concerning eating habits and behaviors like skipping her meals, it's important to monitor her progress closely and be aware of any concerning behaviors that are in addition to this. Although let's acknowledge that this one is a concerning behavior. So we would want to point her back to her clinician or get her connected with someone. Now, we could also monitor for things like signs of relapse. So we want to keep out for those signs that she's struggling with disordered eating again, things like restricting her calories more, obsessive thoughts about food, compulsive exercise. We could even say something to her to encourage her to connect with that clinician about skipping her meals, as saying something like, I commend you for seeking help and working towards a healthier lifestyle. It's important to remember that your health and well-being are the priority, not just your weight. Together, we can work towards a plan that promotes healthy habits and supports your overall health and happiness. It's also important to recognize that managing anorexia nervosa can be challenging. And I want you to know that I'm here to offer support and resources. It may be helpful to consider working with a registered dietitian or an eating disorder specialist who can provide additional guidance and support as you continue on this journey. Is this something you're open to exploring as we work together? We'd also want to watch for changes in mood or behavior. Eating disorders often go hand in hand with anxiety, depression, or other mental health issues. And if Emily exhibits changes in her mood or behavior, it's important to address those issues with her and possibly refer her out to a mental health professional. The coaching intention here is to help her develop a healthy relationship with food and exercise, to give her the tools that she needs to implement her clinician's plan for her, and give her a safe and supportive coaching relationship to work with her vision and her goals. Hope I'm not going to lose my voice. I'm enjoying this. And promoting a positive body image and self-confidence. So we're at the end. Our key takeaways. Mental health matters. We know this. 50% of people in the USA will experience a mental health challenge at some point in their life. Health and wellness coaches are primed with plenty of tools and skills to help clients challenged with mental health conditions to help them be happier and healthier humans. And health and wellness coaches must be familiar with and hold to the scope of practice, referring clients to other healthcare professionals when necessary. As we wrap up our presentation, thank you guys so much for hanging in there with me. I apologize for my voice, but I want to personally extend an invitation for you to join our coaching community. We have a ton of helpful resources available to help you manage your coaching practice, all in the form of our dynamic practice management platform. So in our coaching resource library folder, it has some of the tools that we mentioned in this workshop and things like the vision board, self-care quiz. We even have referral resources in there, all of which you can use to support your clients. We're really passionate about the health coaching revolution, and we'd be thrilled to have you join us on the platform. You can access it through the App Store, Google Play, or any web browser at YourCoach.health.